All right, welcome back to Health Matters. Like the guy said, it's time for Ask the Surgeon, brought to you by Everett Bone Joint. Dr. Jeff Mason joins us. How's summer working out for you so far?
It's been great. I've been taking a lot of time off and going here and there and playing with my kids and my new puppy, so it's good.
Nice. I played with my new puppy and I broke my foot.
Yeah, he doesn't have any injuries though. So
yeah, I know. Good. So let's talk about training camp opened in the NFL last week, and there's a slew of injuries already. These guys get to be. Don't you think they get to a certain point where they're so athletic and they play like 110% that I mean, they're talking about getting rid of exhibition games just because of that, right?
Well, that absolutely happens. I mean, I think it was Jeremy Maclin, the
Yes.
wide receiver for Philadelphia.
Yep.
It was a non-contact injury. He tore his ACL, and we see plenty of them that way, probably even more
Yeah.
non-contact than the one you see that Adrian Peterson got that made us all horrified on
Right.
TV. But more often people, they're so fit and powerful, they plant, they cut, and they just tear something loose.
Didn't that happen to RG3 against the Seahawks too? Didn't he plant and then he got hurt?
I can't remember how many Seahawks were clinging to him when it happened.
Yeah.
So I'm not quite sure.
Yeah.
yeah, but you bring up a good point, Jeff. Is the fact is that people think you have to have some kind of contact event to tear your ACL, and it's really, like you said, it's a directional thing or a deceleration.
Absolutely. We see as many, if not more, that are non-contact as we do where someone gets hit.
Was it worse when they had AstroTurf when, you would plant and your foot wouldn't move? Now it's like field turf and it's supposedly better? Or am I wrong?
I think there's actually been shown to be a significant amount of truth to that. AstroTurf, the original versions had tremendous traction, no padding.
Right.
It was terrifying to play, and I played a game or so on AstroTurf way back then, and it was awful.
Uh-huh. Wow. The big thing happened. Percy Harvin, the Seahawks got from Minnesota. He was like the icing on the cake. This is our ticket Super Bowl. And then like day one at practice, he tore his labrum, and there's talk whether he's going to be out for the year, where he's going to have surgery.
Labrum in his hip.
Yes.
And
Why is there a labrum somewhere else?
In the shoulder.
Yeah, there's one in the
Oh,
shoulder
really?
too. Yeah.
Wow.
Yeah.
Yes,
So it's
in
important.
his hip.
Well, that's one of those injuries where it all gets down to the specifics. A lot of people walk around with small labral tears and don't know it, or they have modest symptoms or some irritation. At its worst, it can be devastating for any athlete. We'll see people who come into the office and they'll have clicking and pain even at a sedentary lifestyle. And then other people will say, gee, if I don't do much, it doesn't bother me, but if I try to do this, that, or the other thing, it can be very painful.
Have they confirmed that on MRI? I mean, the torn labrum?
I have not read that.
Well, what they're doing is the Seahawks. They said there was a slight tear in the labrum. The Seahawks doctor said you could play. Percy Harvin says, I want to get a second opinion on this.
Okay, so that second opinion, and the good news for Percy Harvin and the Seahawks is in today's world, there's physicians out there, orthopedic surgeons, that are scoping these hips.
Yeah, I have a partner, Dr. Nowak, scopes hips.
Which tell us about that procedure, because that's something that, I mean, is fairly, I don't know if you want to say new, but
well, it is quite new, and it's a procedure that compared to other arthroscopy is a bit more involved. The hip joint is a lot deeper, and so you need special instrumentation to do it. And once you get in there, it's like a lot of these newer procedures where it's under constant evolution. And if you talk to some surgeons who've been doing it for a little bit longer, they'll say, well, if the labrum's torn, I just take it out. And now other people are saying, no, I'm going to repair the labrum. I'm going to reshape the bone. They're doing more and more. But like a lot of these things, it certainly helps in the short term. But the question will be, are you preserving these hips from going on to arthritic degeneration? How well do they work in the long term? And also the recovery period is a lot longer than if you have, for example, a meniscal procedure for your knee.
And what is the recovery period for a hip scope?
A lot of times, Dr. Nowak will keep these people non-weight bearing for 6 weeks, which is, if you have a meniscal repair in your knee, it's similar, but it's not the same as having, a piece of your torn meniscus removed when we tell people that they can walk on it the next day.
Yeah. Now, are these people that he's doing these scopes on professional football players?
I don't know if he's had any of those. He's had plenty of very active and athletic people, but he's also done them on people who are just utterly miserable, who are just trying to engage in what you think of as a normal sedentary lifestyle.
And where does this pain, where is this happening at? I mean, what kind of, is it like right at your hip? Because I think we had a discussion once that hip pain is not what you think it is. It's not where you think it is.
Well, the hip
right?
joint can refer in different parts of your body. People that have labral tears in the hip generally have, like Dr. Mason was saying, sometimes they have clicking, popping, but they also have a lot of internal, like groin pain. They have a lot of groin pain they describe in their groin area.
Yeah, a not uncommon thing with certain tears is you'll have some pain in the groin that's fairly mild, but then if you rotate your hip the wrong way, it goes from mild to severe in a moment. So if you have those types of symptoms, any kind of reasonable or let's say serious athletic activity could really be ruled out, because when it hurts so much that you're not really capable of gritting your teeth and putting up with it.
Wow. It says the doctor in New York advises Harvin that season-ending surgery is needed to repair the hip, possibly, and keep your fingers crossed for the next 24 hours. We should know more about it. We talked about Jeremy Maclin. This doesn't sound very nice. Baltimore tight end Dennis Pitta underwent surgery Saturday night and will miss the entire season after dislocating his hip in practice.
That's hard.
You don't hear that very often, do you?
Well, the hip doesn't necessarily, not real common dislocator.
That's a very grim and dramatic sports injury. And more often, the hip dislocations are associated with high-speed trauma, like motor vehicle accidents. In athletic contexts, not always, obviously, with Mr. Pitta and Bo Jackson for that matter, but more often you see them in contexts like bicycle racing, motorcycle racing, something where there's a lot more velocity involved than people can usually develop on their own, but clearly that's not always the case.
Right.
Did they say how it happened, or was it just an awkward tackle, or?
It occurred when Pitta collided with the safety in the back of the end zone vying for a pass.
And you mentioned Bo Jackson, and the problem with Bo Jackson's, he was a fairly benign tackle, if you remember and have seen the video, and he dislocated and probably due to sheer power, but he also tore this blood vessel that's pretty important. So talk about that trauma.
Yeah, one of the things that can happen when you dislocate a hip is, depending on the individual, a lot of the blood supply to the head of the femur, the head of the thigh bone, comes in through a ligament that comes right out of the base of the joint. So if the joint is dislocated, that blood supply is disrupted, and sometimes that will kill off the bone. Other people have much better blood supply through other vessels that are less likely to be disrupted with the dislocation, but it can be that's why Bo Jackson ended up having a total hip after that single event, because the blood supply to the femoral head was destroyed and the bone died.
Is it something dislocating your hip from? Would it happen just because he's been hit a million times, or is it just kind of a fluke type thing that happens?
It's a bit of a fluke. I don't know. What I suspect in cases like this is that the direction and the variety of dislocation would be different from what you might experience in a motor vehicle accident or something. Maybe the hip is being planted on the ground and levered out by contact or something like that, but that's speculative.
And reality is, if that hip dislocates, that's significant pain, and the muscles are going to retract. And you don't reduce these hips out on the field. This person's going to the hospital with medication, and you're going to knock them out, basically.
Right. The whole question is, can it be reduced in the emergency room, or do you have to go upstairs to the operating room and do a surgery? And so with someone like him, the question is, what was the surgery that was done? Were they just trying to repair damaged tissue, or what was the story? But that's kind of details at this point for him.
Yeah, I don't have that on here. Switching to baseball, the big blow to the Seattle Mariners, their young rookie phenom, former Everett Aquasox Mike Zunino, was placed on the 15-day disabled list because of a broken bone in his left hand, the Hamate bone. And I never knew what that even was until Ken Griffey Jr. made that famous years ago. He broke his Hamate bone, and he did it on a swing. How does that happen?
Well, you can do it on a swing, but you can also do it with direct impact, because the hamate, typically what's fractured is called the hook of the hamate, and it's part of the bone that, as everything else in the wrist, a lot of stuff attaches to it, and either through direct impact it can be broken off, but other times torque, such as swinging a bat, can do it too. And so when it breaks, it's very, very difficult to get it to heal. But that being said, that's not always that important. Mostly if you just go take out the fragment, you can allow things to simmer down. So it's not the world's most devastating injury, happily.
And being a catcher, he probably is a result of contusion, I would imagine. I mean,
that was my first assumption, yes.
Yeah, catching a fastball all the time. So
is it something that he's on the 15-day DL? Is he going to be back this year from that, you think?
I would say there's a good chance that he could be, yes.
Well, that's good to know. And then Albert Pujols is out for the year, it was reported today, because of plantar fasciitis.
There we go, that old plantar fasciitis.
Yeah, it seems like to be the chic sports injury now. And, of course, you know that I've caused a lot of cases when I worked at Nordstrom.
Yeah, we've heard about that. Yeah.
I thought, do they have surgery for plantar fasciitis?
They do, but it's rarely performed because it's not reliable. The incidence of irritating or sometimes more than irritating complications is fairly high. And when you have the surgery, you simply go in and release the plantar fascia if it's chronically inflamed and damaged and won't heal. And it can work well, but more often it's not necessary if you're just willing to give it time to get better. But the time to get better can take quite a few months.
Is that something that once you have it you'll always get it?
No.
Yeah, patients ask it all the time, and I agree, not necessarily. A lot of times people ask if I had it on my left, am I going to get it on my right? And again, not necessarily.
What do you do to rehab that? What do you do for people with plantar fasciitis?
Well, we work on, first of all, we're going to modify their activity or stop activity sometimes is the best way to handle it. That's what they're doing with Pujols, is just getting them to shut down. And then we'll work on flexibility. We'll do some deep tissue work, kind of promote some healing. And then look at if there's anything mechanically missing in that person's movement pattern or range of motion and try to correct it with strength, function, and balance.
That's exactly right. You're trying to work on all of the structures in the back of the foot, ankle, and leg rather than just saying, here's a specific tissue that's irritated. You're trying to figure out how this person got there.
Mm-hmm.
It's a tough one. It is a tough one. It's not a favorite diagnosis for a lot of people because sometimes you just have to shut the patient down completely.
It's one of those things, too, that I know people of every age group that have this, young and old.
I think someone said one time everybody's going to experience it at some point in time in their life. Have you had it yet?
No.
Oh, yeah. You're jinxed now. Maureen, you've had it, haven't you?
Of course I have. Yeah,
of course
I have. I do it for the show.
Yeah, exactly.
Also, speaking of hip injuries, Lady Gaga.
Come on.
Yeah, she had a labral tear. She had a broken hip. Surgery too.
She played hockey goalie.
I don't think so. I don't think so.
I'm not sure I even want to know how she got a label on her hip.
When we come back, we're going to talk to Carl Jansen about travel medicine. Doc Mason, thanks a lot for coming on with us.
Thank you.
We also wanted to mention too, but we're out of time. Dr. Frank Jobe. He's probably one of your heroes.
Oh yes.
He was inducted into the Major League Baseball
Tommy
Hall
John.
of Fame. He performed Tommy John surgery. So,
that's right.
Anyways, that's it for us. Stick around for Carl Jansen. I'm Maury Eskenazi.
I'm Shannon O'Kelley. Stay fit and stay healthy.